Hey everyone, so today we're going to be explaining the BBL procedure, otherwise known as Brazilian butt lift. This is a procedure that Dr. Hanna does here in the office, and he does it under local anesthesia with sometimes a combination of IV sedation. First and foremost, we want you to come in for a consultation. Consultations are free to make sure you are a good candidate. A good candidate will include, for one, having enough fat, and the second one, having good quality fat. We don't want to have to scrape fat from every part of your body just to be able to inject it in the butt. This procedure is going to be done in 3 steps. The first step is the local anesthetic, so getting you nice and numb and comfortable on the areas that Dr. Hanna is going to be working. Now, different from our regular liposuction procedure, we will not be using the Vaser, which will melt the fat and tighten the skin from the inside, because we do not want to inject melted fat into your butt. We want good quality, healthy fat cells to be injecting. So we will be skipping out on that part of the procedure and jumping straight into the liposuction to remove the fat and to sculpt the body. Following the liposuction, once we have all the fat harvested, we will separate the fat from any fluid, and we will also be mixing the fat with antibiotics. Then Dr. Hanna will be injecting the fat into your butt and sculpting it to your desired outcome. So this procedure, you're gonna have about the same as lipo, about a 1-week downtime of being sore. However, with the BBL, you cannot sit directly on your butt for 4 weeks. So we don't want you to be constantly putting pressure. It's like having a baby tomato in a garden. You know, you're trying to grow it, and if you're there stomping on it for 8 hours a day, it's probably not gonna grow and survive. It is very crucial that you find an accommodation for sitting on your butt, especially if you have a desk job. So there are booty buddies that you can purchase online. Some of our patients will often use just a rolled up towel to place in the back of their knees, so it relieves the pressure from sitting directly on your butt. So you are able to sit, whether it's in the car to go to the grocery store or to sit at work, without putting any pressure directly on your butt. This will also include having to sleep either on your stomach or on your side. Some common questions that people ask after the BBL procedure is, how much of my fat will survive? So about 80% of what Dr. Hanna injects will actually survive. You will have some swelling for the first 2 weeks, but after that, what you have is pretty much what you get. We do want you to continue to wear a compression garment for 8 weeks following the procedure, and this will just help to mold and shape everything correctly. A lot of people want to know if they can lose their weight, if they'll lose it in their butt. So it is fat, it is part of your body, so depending on where you lose your weight from, if you do go through a weight loss, there is the chance that you can lose your butt. If you have any further questions, please feel free to contact us here at the office or set up a free consultation.